NC Impact is made possible by funding from Civic Federal Credit Union. NC Impact is a production of UNC TV Public Media North Carolina in association with the University of North Carolina School of Government.
It just is amazing what this neighborhood has been able to do.
Obesity is a serious health problem in many communities across the state. How a Gaston County neighborhood is reversing this trend and building a healthier future. This is NC Impact. I'm Anita Brown-Graham, and welcome to NC Impact. This week, we're looking at how communities are working together to improve health outcomes by fighting against obesity. Joining us are Mark Holmes, Director of the Cecil G. Shep Center at the University of North Carolina at Chapel Hill, Dr. Laura Gerald, President of the Kate B. Reynolds Charitable Trust, and Michelle Rees, Interim Director of the North Carolina Institute of Medicine. Before we go to our esteemed expert panelists, let's look at some of the barriers to accessing healthy foods many people in our state face, and how that can lead to chronic diseases related to obesity. NC Impact's David Hurst reports.
Growing up in a single-parent home, Elvira Hoke and her siblings often had to do the grocery shopping.
Mama had to be at work, so she gave us a list, what we need to do, and we done it.
Hoke remembers being unable to buy the fresh, healthy foods because they simply couldn't afford it.
It was a struggle, but we made it through. And of course, a lot of processed foods.
She says it was a common struggle throughout the Highland community in Gastonia. And the lack of access to fresh, affordable food was one of the contributing factors to health issues such as obesity and diabetes in the community.
If you're eating healthy, you're losing weight, your blood pressure coming down, and you're living longer. And you're teaching your kids, okay, this is how you cook a healthy meal.
Thank you.
It's an issue that's only been made worse by COVID-19.
But once the pandemic hit,
Pastor Rodney Freeman with Mount Zion Restoration Church holds a feeding program every Thursday. He says food insecurity has been on the rise, and since the pandemic began, they've been serving about 1,000 more people a week.
a lot of people lost their jobs. They understand that this was the place that they got their grocery from. This was the place that they got their food from.
Pastor Freeman says for some, this is the only place they're able to get fresh, healthy food since they can't afford to buy it at the store.
I tell people this is 15 minutes of hope, that once you come on the campus, you come through here, it just lets you know that somebody cares.
For Hoke, her hope is that the next generation will have better access to fresh food and the knowledge to make healthier food choices.
We're changing the minds of our kids, saying, it's better ways and better opportunities for you to live a healthy and better life.
15 minutes of hope, you gotta love that. Mark Holmes, let's start with you, and let's just try to get our heads wrapped around this issue of obesity. What is driving the rise in obesity in our state?
So when we think about obesity, it's really a simple equation of energy in and energy out. And so let's talk about both sides of that. From the energy in standpoint, that's food and nutrition. The kinds of foods that we eat today are different than they were 30, 40 years ago. We're getting foods that are higher in caloric density. Cheap, convenient foods are often some of the least healthy. Go to a restaurant and compare the price of a hamburger and a salad, and you can see that pretty easily. We have, and then there's also the issue of what do people do with these foods. And I know that even a couple years ago, if I'd gone to the grocery store and grabbed a bag of Brussels sprouts, I wouldn't know where to begin, how to do anything with it. And so we need, as mentioned in the piece there, how do we cook our healthy foods? How do we prepare fruits and veggies in a way that people enjoy eating them? On the energy output side, that's physical activity. So thinking about everything about how we exercise and how we spend our day. The way that many of us spend our day, currently our work day, is sitting in a chair rather than getting up and moving around. That's fewer calories that you're burning. We get in our car rather than go for a walk or take a bike ride. We may live in an environment where it's not safe or there aren't ample opportunities to get that physical exercise. I know growing up in rural Michigan, the best place to exercise was at the inside of the high school, and so people would walk there at night, particularly in the winter, because that was it. There weren't really a lot of opportunities like that. And so combining those two is what we lead to see where people, typically the typical adult now adds 1 to 2 pounds every year. And whereas 1 to 2 pounds 1 year doesn't really make a huge difference, do that over 30 years. And this is what leads us to our obesity rate that we're seeing today.
So, Laura, we saw in the story that preventing and treating obesity is more than just about healthcare access, but it's also about access to healthy foods, as Mark has said. What is the correlation between obesity and chronic diseases and the food that you eat? Help us put this puzzle together.
Well, within the healthcare delivery system, people are often accessing those services because of the outcomes and effects of obesity. And we know that obesity increases your risk factors for a number of chronic diseases. It increases your high blood pressure and high cholesterol rates that can often lead to heart disease and stroke. We know that obesity is related to higher rates of type 2 diabetes. There are certain types of cancer that are related to obesity, colorectal cancer and breast cancer being among them. And I do know from my earlier days of practicing medicine in a rural community that, again, those chronic diseases and downstream effects of obesity are not equally distributed within the population. We see certain populations that carry a greater burden of chronic disease and complications. And so, again, one thing we know from practicing medicine is that even individual decisions that Mark has described about eating and active living, those are done in context. People make decisions often in the context of their community and within their social conditions. And so what we've learned is that if we want to prevent obesity itself, which is a way to prevent chronic diseases, then we have to look more upstream at social drivers of health and look at the context in which people are making health decisions.
Michelle, you just heard Laura mention social drivers of health. We hear this term a lot these days for good reason. What do they mean, and how do they play into concerns about rising rates of obesity?
Great, thank you. So loosely speaking, drivers of health are all of the components of a person's life that impact their ability to be healthy. So some of the things that Mark and Laura already talked about, health behaviors, choices about your health, but also structural components and social and economic components, things like education, things like employment, things like income, things like access to health insurance. And that context, as Laura was saying, where people live varies, and that variation leads to those variation in health outcomes. When we talk about drivers of health in relation to obesity, things like, the cost of food certainly plays into things. Things like healthy produce, lean meats, things that are not processed tend to be higher in cost, and so that impacts people's ability to access those things. But there's also a lot of structural factors. So in North Carolina, about 500,000 people in our state live in areas that are known as food deserts. And that means that there is not ready access to supermarkets. People might have access to corner stores or convenience stores, but they don't have the access to a supermarket that might have the fresher food or the lower cost healthy food that they need. So there's that combination we see between things like cost, things like structural factors that impact people's ability to access healthy foods. As Mark was saying, too, things like physical environment in terms of people's ability to have physical activity. If you live in an area where you don't have access to that high school gym, or you don't have a safe sidewalk or a bike lane or a playground to play in, you're going to be less likely to be able to get the physical activity that your body needs.
Wow, thanks. Let's turn our attention to the Healthier Highland initiative in Gastonia. As NC Impact's David Hurst found out, this effort is giving those in the community power to reverse poor health outcomes.
They're not able to be out in the garden throughout the day.
Growing up in the Highland community, Danielle Barber saw firsthand some of the health disparities in her neighborhood.
We're talking disparities in diabetes, disparities in congestive heart failure, hypertension, even tobacco, and definitely obesity is a major issue in the community. Here we have our herb garden.
She's now working in the community to help improve health access and outcomes. She helped launch Healthier Highland, an initiative that began in 2016 after a Blue Cross Blue Shield grant created a community-driven partnership between Kintegra Health and the Highland community.
For so many years and for so long, people, including government, have come in and done things that community members were not in agreement with, and it's had implications.
When taking a look at the health issues in their community, Highland community members decided to tackle obesity first. They believed if they addressed this issue with healthy eating and living, it would improve other health issues within the community.
And listen to what people are saying are the obstacles and the barriers, because they know, they live them every day.
Healthier Highland helped bring over $4 million worth of improved infrastructure to the neighborhood. That includes new homes, improved street lighting, as well as upgrades to the rec center.
You know, just seeing the changes there, that we have an opportunity to have a voice. And that's so important to any community, and it's important to our community.
Highland residents are also now walking distance to a health center, have access to a community garden, and have seen improvements to their local park and walking track.
Okra's my favorite.
Arbor says it's beginning to make a difference, and it's creating a healthier and more hopeful future.
What we've come to realize is that it is important, it is essential to have access to healthy food, have access to health care, have access to a place to become physically fit in order to have positive health outcomes.
Michelle, we see in this story community leaders recognizing that members of the Highland neighborhood need the power to make their own decision about what it takes to improve local health outcomes. Why is that so important?
So as we heard in the video, you know, people who are in the community have the best understanding of the types of things that are needed. They understand those personal decisions. They understand why somebody might have, different financial situations that lead them to have different means for certain types of foods. They might understand people's personal schedules that might impact their ability to cook a meal or to go shopping. And they also have a better understanding of the physical environment factors that we talked about earlier. They might know that that community needs transportation to the recreation center, or that community needs better lighting at the baseball field so that people can access it after dark in the evening. So really, working with the individuals in the community to understand both those personal decisions and the structural factors that are important to people's ability to have healthy lives.
Mark, let me go to you because as Michelle has said, people in communities know what they need, and we certainly saw evidence of that in the video. But it's not just enough to get people in a room and say, figure out what you need and then go do it. So what are the other necessary ingredients that make a program like this one in Gastonia successful?
Well, it's not just knowing what the community needs, but what the community has, and having an asset-based approach to what the community can bring together to solve whatever their priority is. So maybe it's the pastor at the Presbyterian church. Well, he is got a lot of energy, and we should get him involved. But you can't have this doctor and this nurse in the same room together because they've been disagreeing for years. And so figuring out that's not something you can bring when you're coming in from outside. You have to have the people who are there who know not only, as Michelle says, what's needed, but what we have to offer. And understanding that each community has assets and they all have something to offer, that's something that the community members themselves are really going to be in the best position to bring. So all combined of that, you have a sustainability is what's necessary. And that's really one of the key aspects here is we can come in and we can fund something or get something off the ground for 2 years, but what's going to happen the day that funding ends? Who's going to step up and say, I think this is important. What can we do together to keep this effort going? Whether it's keeping that community garden happening, whether it's stocking that food bank. Is it a local business who's really interested in supporting this, or a foundation, or is this going to be something that we need to have a fund drive? And we've seen the successes and what we do to keep this going. And the sustainability will come from the community's buy-in. And so to Michelle's point, not only what is our priority, but also what can we bring in order to make that, to keep this success going.
Thank you. Laura, the Trust has a similar program called Healthy Places North Carolina. Can you tell us a little bit about the program, what communities it covers, and what the impact of the program has been to date? And I'm pretty sure our viewers are going to want to know how a community can get involved.
The Healthy Places Initiative is a long-term significant commitment of the KB Reynolds Charitable Trust. We're a private foundation that around 2012 decided to make a commitment to 10 communities over a 10-year period at about $100 million level. And so it's essentially Healthy Places. It's kind of like Healthy Highland Initiative times 10. And what we found is that when we think about our mission, which is to improve health for North Carolinians who are living with poverty, we find that those who are most impacted often by poverty, those who are dealing with the worst health outcomes, are often in rural communities that are very vibrant in natural resources and in human resources, but yet are under-resourced economically. And so we've chosen 10 communities around the state to invest in. In the west, there's McDowell and Burke counties. In the middle part of the state, there's Rockingham County. And then in the east, we have Edgecombe, Nash, Halifax counties, Beaufort County, and then most recently, Robeson, Columbus, and Bladen counties have been added.
You have a terrific memory.
I've been working with these communities for a while now, and as again, Mark, and as the video pointed out, in terms of impact, one of the things we've noted is that it's not about the 1 to 2 year program that comes and goes with funding. What we're really working with communities on is building agency and building organizational capacity, a power base to be able to address the needs of community members. And we've started with a basic value, just as you've heard on the video, of starting by listening to community, and most importantly, listening to people who have been most impacted by the health outcomes that you would like to see change. And what we hear in communities across the state is that indeed, marginalized communities are marginalized. I mean, imagine that. And so people are saying, I've not been brought to the table before in solutions. Solutions have been thrust upon us or brought to us, but we have not been included in coming up with what needs to be changed. Because as Michelle and Mark are saying, people know what needs to be addressed within their communities.
Thank you all. We're gonna go to our third story. We have recognized food access as being an important social driver of health outcomes. In the Highland neighborhood, a community garden is empowering the community's youth to build a healthier neighborhood. NC Impact's David Hurst reports.
And they're not real expensive either. One is actually...
When teens come to the Highland Community Garden for the first time, it's often an eye-opening experience.
Most students, when they come out here, it's their first time seeing where the plants are, even where the food comes from. Nothing came out of this bed.
Sierra Mack oversees about a dozen teenagers known as the Highland Cultivators. The teens manage the garden and even decide which fruits and vegetables to grow.
There's parks over here, there's a library, there's a gym, but there's nothing really that they own, that's theirs, that they have ownership of. So that's important.
The garden is on a city-owned lot and was built with federal community development block grant money. The teens grow fruits and vegetables and sell it back to the Highland community at a discount.
I didn't know half of this stuff grew like this, like okra. I thought it was like in the ground. Not a plant so taller than me.
Especially since you got some okra over there.
The teens receive guidance from the Gaston County Cooperative Extension as they're taught different farming practices and techniques.
It's a lot of work, but I think it's a discipline and a skill that is needed, is desired, and can be used as an asset for any community. The rest of this basil can be...
And it's an asset that's relatively new after opening earlier this year. Max says this is just the beginning of a program that has the potential to not only improve food access, but also to change lives.
So that's definitely going to transform generations. They're going to pass that down to their children as well. And obviously, healthy food, you're going to be a healthier person, have a healthier life.
Laura, I know how passionate you are about young people. When you think of community change, how do you think of the role youth might play in helping us reverse trends of poor health outcomes?
The pediatrician in me is grateful for the question. When we talk to impacted people in community, many of these communities are dealing with multiple community stressors, economic conditions that have changed or worsened over the last few years, educational resources that need greater investment. Many communities are dealing with the stress of natural disasters, even before COVID, dealing with Matthew and other hurricanes, and now COVID has struck. And again, when you talk to community leaders, what they're most concerned about are their youth and what sort of hope they can instill in the next generation. And so there is a real outpouring of concern about traumas that youth may be exposed to that we can help to reverse. And again, just the future of the community and the future of the youth is something that is very important. So we do have a number of Healthy Places communities that are specifically working with youth to help empower them. And one thing we know medically that's, again, perhaps hard to believe and understand, a lot of what we are dealing with in adulthood, from obesity and other chronic diseases, can be related to really early childhood experiences, even under the age of 2. We know that conditions and traumas that very young children have been exposed to can have effects on mental health, on obesity rates, on chronic disease rates. Again, much both in childhood, but also much later in life. And so we have communities working very specifically with youth to help try to prevent traumas, to help try to build resilient youth, to involve youth in the activities that we've mentioned, the structural changes, the systems changes. And again, we see that instilling a great deal of hope in community.
So that's a beautiful segue to my next question, which I'm going to give to you, Michelle. We've heard Laura talk about sort of investing in the process and investing at the process at a grassroots level and trusting the process. What are some ways community leaders can build trust and a sense of ownership with everyone in the neighborhood in order to implement the kind of changes that will improve health outcomes?
Yeah, so I'm probably going to echo some things that Laura and Mark have already said a little bit. We heard in the video, it was great to hear, the teens that are participating in the community garden talk about, their participation, their relationship with the community, and their, real ownership of that project and that work. For community leaders to make sure that they're hearing those voices, those diverse voices, racial, ethnic diversity, age diversity, socioeconomic diversity, really hearing from a cross-section within their community. And then, like we were talking about before, identifying what's needed in the community, but what's already there in the community, those assets and those strengths in the community, and hearing, we need this, but we also have this, and how can we expand on that, and how can we build on that? And so those, that diversity of voices and that understanding of, those needs and those assets are really going to be really crucial to helping community leaders build that sense of trust and build that sense of ownership for whatever the program is that they're implementing. I'd also echo, I think both Laura and Mark talked about sustainability and patience, and the understanding that a lot of this work, whether it's from the philanthropic side or whether it's from, the policy side at a state level or a local level, you're not going to necessarily see an impact in 6 months or a year. Especially some of this work with youth, if we're talking about adverse childhood experiences, we're looking at decades that we have to look back and say, something that we did in, 2005 may be just bearing fruit right now, and we really have to figure out ways to measure that and look at the ways that those impacts have impacts across all of that time.
I'm reminded of the old saw that we often hear in public health, and if you've heard this before, I apologize, but 2 fishermen are standing on a bank on a river, and they're having a good day, getting their fish, and someone comes by flashing and, help me, save me, and they throw him, the guy a ring, and they pull him in and says, oh, are you okay? Yeah. Another person floats down the river. They throw in another ring, and they're doing this over and over. All these people are floating down the river. And the fisherman, one says, man, one starts walking up the bank, and the one says, where are you going? He says, well, I'm figuring out what's going upstream. Let's deal with it up there rather than spend all the time down here.
Up there, right? Exactly.
And that's where we are in a lot of what we're dealing with in healthcare. Is we have our doctors, our nurses, our hospitals, our healthcare providers are standing here on the bank, and they're seeing all these people floating by, and they're trying to do everything they can. But yet, if we would just walk a mile upstream or quarter mile, whatever, and start dealing with some of these things we've been talking about for the last 30 minutes, about food deserts and finding places for people to exercise and give them their secure housing that we need in order to not be floating down the river.
I could probably go on for the rest of the afternoon, but I suspect you all might have some other things on your plates. So, Mark, Laura, Michelle, thank you so much for this conversation. I'm sure the chat box on Facebook is just blowing up. And thank you for watching and engaging. There are solutions available to us if we work together. Tell us what your community is doing or how we can help you. Email us at ncimpact@unc.edu or message us on Twitter or Facebook. And you can always join the conversation on Facebook Live. Coming up on NC Impact, some rural communities are still reeling because their main industries left town. How one community is using historic preservation to revitalize their economy.
NC Impact is made possible by funding from Civic Federal Credit Union. NC Impact is a production of UNC TV in association with the University of North Carolina School of Government.